Welcome to QPTV's Health Update. I'm Roslyn Nieves. I'm with Dr. Debra Weinstock. She's a podiatrist, and we're going to talk about diabetes and how it impacts a patient's foot. Thank you, doctor, for joining me.
Thank you very much.
What do you typically see in diabetic patients?
In my practice, I see many diabetic patients, and the patients that come to me are generally the people that do care about their feet and take an interest in themselves. The most important thing with diabetes is controlling the patient's blood sugar as well as their blood pressure. When it comes to the feet, like the eyes, are a window to what's happening in the body. So when you see a breakdown on the foot, you might see a sore on the foot, you might see discoloration of the skin, loss of hair. Those are all signs of diabetes and the toll that diabetes takes on both the blood as well as the nerve system.
Now, what's this first step to getting better or keeping it at bay?
The first step is the patient has to be on the team, on their team. The second step is observation. The person must observe their feet. They must look at their feet every day to make sure that there's no redness, irritation. They have to check the wear and tear of their shoes to make sure that there's no rubbing caused by the shoes. The shoe shouldn't be worn out in any area. And in particularly, there shouldn't be any pebble in the shoe or pin or nail on the outside of the shoe. Because unfortunately, one of the biggest problems with diabetes is a problem with the nerves, and they cannot feel on their foot. So where I could take a sharp pin and put it to their hand, and they may feel the sharp pin on their hand, but take that same sharp pin and put it on their foot, and they do not feel the sharp pin.
What is a relief for a diabetic patient who has black and blue or some tearing in between the toes, from perspiring?
Again, the most important thing is observation. So if they see that where their skin has a break in their skin, a rash on their skin, they of course should do some simple home care treatment, make sure the foot is clean, apply an antiseptic to an open wound, but they absolutely should come and see their podiatrist, go for the medical care. Don't wait a week, don't wait 3 weeks, because at that point it's going to be a big problem. What my favorite saying with my diabetic patients are, let's keep a small problem small. You see something on your feet, you take care of it, and for 99% of the cases, I'm hoping that should be the ratio, but for many, many cases, once something's taken care of in a prompt way, the patient should not have a problem. It's unfortunately due to neglect that patients do have problems.
Is it safe for men and women to get a pedicure if you suffer from diabetes?
Okay. Unfortunately, it's a very popular in our society that people go for pedicures. I would advise anyone that has any problem with diabetes or any circulation issues not to go to a pedicure. When you go for a pedicurist, they do not ask you if you have diabetes. They do not ask you if you have any circulation or issues. It is strictly a cosmetic treatment. Your feet are so important. Please, if you have diabetes or any kind of circulation issues, do not go to have a pedicure. Do not go to your local podiatrist who's trained to help you and treat you. And the cosmetic stuff, you'll just have to do yourself.
Last question. Is it something that you can do to be proactive to keep your feet nice and moist so they don't crack and peel and stuff like that?
That's a very good question, yes. Absolutely, again, daily observation, application of an emollient on your skin, preferably not between your toes. If you have any type of cracking or cut of the skin, if the emollient isn't working, again, see your local podiatrist, be proactive, prevent problems, and keep your feet and yourself healthy.
Thank you, doctor, for joining me. Thank you, everyone, for joining me on QPTV's Health Update.